Research shows that tilting the head forward by 45 degrees can put up to 50 pounds of pressure on the developing spine. Spine surgeons are now seeing young patients with disc issues. So, what are you seeing in your practice in terms of neck pain, back pain, headaches in kids? What's the long-term impact of that?
Yeah, so I think the long-term consequences we don't quite know yet, but I do think that absolutely I'm noticing more back pain issues. And I think what I find interesting about it is when I talk to families and I talk to patients, they would agree. They would agree that they spend more time leaning forward. They would agree that they have more neck strain. I even see thumb strain, which definitely relates to texting.
Yeah.
And going back to what you said earlier about what we're meant to do, we're not meant to be leaning forward all the time and
Yeah.
hunched over with our heads forward and our necks forward. We're meant to be moving. And I think, I had on my podcast a spine surgeon, Dr. Skaggs, who works at Cedar Sinai in Los Angeles. And
Hmm.
he said to me that life is a kyphosing event, meaning that life, you fall forward as you age to begin with. And so
Yeah.
we're compounding that now with, constantly looking at our phone and looking forward. So his answer to me was we really have to encourage our kids because it's actually really hard to stand up straight and have great
Yeah.
posture. So the more we encourage movement and the more time we encourage putting the phone down, uh, the better it is, because we don't actually know the long-term consequences, but we can imagine that it's that, if life itself brings us to fall forward into kyphos, we don't want to speed that up. I'm motivated when I see somebody older who looks like they're hunched forward. It reminds me that I really want to practice putting my phone away, encourage my kids to move around and put their phones away as well.